there, welcome. My name is Cassandra Cannon. I am a licensed clinical psychologist, and I am an APA-approved sponsor to provide continuing education. And I just launched a course called Telehealth, Efficacy, Laws, and Ethics. And one major component of that course is jurisprudence considerations. And what that means is if my client goes on vacation or if they are a college student and they go home for the summer, can I still treat them? And because I get that question a lot, I wanted to answer that briefly here for you. The most important thing to note is your client needs to be physically located in the state where you are licensed to treat at the time of your sessions. What that means is if you are licensed in California only and your client goes home for the summer to Oregon, you need to be licensed in Oregon to treat your client. Now, what's important to note is some states will allow you to treat your client for a certain number of sessions. Some of them want you to note them that you're doing that. Others don't. Some states actually require you to get a temporary license or a temporary permit. It depends on that state. So I know for me, at the beginning of the pandemic, I was in San Diego. I had a lot of kids in college going home during that time. It was very easy for me to continue treating my client who went home to Arizona because when I reached out to Arizona, they very quickly sent me a temporary permit and said, thank you. When I reached out to Washington State, they would not offer me any type of temporary permit or any way to continue to treat her while she was finding a new clinician. They did not give me any other avenue. And so, unfortunately, I couldn't continue to treat her. If I did, I would be risking my license because the state of Washington could reach out to California and say, Dr. Cannon is treating in the state of Washington without a license to practice. So it's really important to know that it's not where your client's residence is, because some clients will say, well, I mean, I have 2 homes and, I might spend a lot of my time in this state, but my residence and my mailing address is in California, where one of the states I'm licensed. So it does not matter what their residence is or their mailing address. It's where they are physically located. That's why, for example, when I was working at a residential treatment center, someone could come from New York, but they were physically located in California, which is where I was licensed and where I was practicing psychology. So that's really important to know. And I really encourage you not to try to call your work coaching or consulting to try to get around that. It's ultimately just dishonest, and you really don't want to risk your license. Now, something else to note, psychologists, we have something called PSYPACT. What that is it's a coalition of different states that have decided to get together and allow reciprocity among states. And not all states are a part of this. For me, California is not in PSYPACT. Something to note, though, I am licensed in Nevada. And someone might say, well, I could get licensed in a PSYPACT state, call that my home state, and then, treat anybody who's physically located in a PSYPACT state. Don't do that. First and foremost, if you are licensed in a PSYPACT state, you need to declare a home state where you are physically located at the time where you're providing treatment. So that does not mean that if you're licensed in New York and you decide to get licensed in Colorado and say Colorado is my home state, but you're physically located in New York, that is not permissible. I've heard of people trying to do that. Don't do that. It's not honest and it's not ethical. And ultimately, you really need to be familiar with the laws and ethics of the state where your client is physically located. So that's really important to know. I don't believe that there's any type of coalition set up for other types of mental health treatment providers, but in general, find out. I had clients going back to Idaho. They said, hey, just tell us when you started, tell us when you're done, and that's okay, and we'll give you a temporary permit. I had a harder time with Oregon. Oregon, I had to go through a whole licensing process, but they wouldn't give me a license. They would only give me a temporary license. And I had to estimate how many sessions and tell them when I was done. And it was quite an intense process. So you have to, again, recap. Your client needs to be physically located in the state where you are licensed at the time where you are providing treatment. If they are not, you need to understand and know what that state board requires and allows. And the only time where you might even be able to stretch it is if it is a genuine emergency and they're physically located elsewhere. Then, and again, this would be a gray area, so I am not recommending this, but you may be able to document, I provided clinical care to this person because they were a safety risk to themselves. So you need to be documenting that. And what I do, because I'm telehealth only, in each of my clients' notes, I have their address where they're physically located at the time. And most people, they're in the same place. So I just note the background and I know that they're in the same place. Other people, they might be in their office instead of home. And so I get that address. That's important not only for your own notation and proof that you are doing your best to follow laws and ethics, but also what if they have a seizure, a heart attack? What if there's a medical emergency? You need to know where they are so you can call and get them the help that they need. I actually had a colleague where that happened. Someone had a seizure in a session. Unfortunately, they knew where they were located and they could send medical care to go help them. So notate where they are physically located. Something else to know, there's lots of confusion around these different federal laws that are expiring or not expiring. Most of the federal laws that were relaxed when it came to telehealth for behavioral health and mental health, those actually, most of them were kept the same. And so all of these different things that might be happening, for the most part, the relaxed federal laws have stayed the same. They are allowing more access to telehealth. And I actually go through those in the continuing education course. Another thing to remember is just because the federal law says that something's okay, you need to know the state law and that application, and whichever law is more strict is the law that you need to follow, which is why we're following the state laws when it comes to physical location, because that's more strict. Something else to know about federal law is it's more about if you're going to get paid. So let's say that it's more about Medicare and if you're going to get paid. So if you are providing one of the Medicare rules is if you have to provide telehealth with video versus audio. And a requirement is that it be video unless under certain conditions it can be audio only. Or a Medicare requirement is you need to see someone in person um, within 6 months of that telehealth appointment. Really, if you don't do that, if you only see them telehealth, well, if you're billing Medicare, then that's going to impact you. But if you're self-care, if you're self-pay, that doesn't matter. Here's something else you need to know, though, is if you are a client, apologies, if you are a clinician and you are treating someone who has Medicare, but you don't take Medicare and they're paying you self-pay, you need to have already opted out of Medicare as a treatment provider. And you need to have a separate private contract with that client. So if you're getting an intake call and someone is 65 or older, you need to ask them, are you a Medicare beneficiary? If they say yes, you need to have already opted out of Medicare, and that's a process. I actually walk you through that, and I also have a digital download available to you as well to opt out of Medicare. There's also a private contract that you need to have that has specific requirements that you have with them that they sign and review. So that's also important to know is if someone's 65 or older, they're a Medicare beneficiary, and remember certain disability, other aspects they might also be a Medicare beneficiary. So you need to know, are you a Medicare beneficiary? Yes. Okay. We need to discuss this private contract, which includes that I won't bill Medicare and you won't bill or try to get reimbursed through Medicare. So that's the Medicare opt-out process. So I hope this cleared up a couple questions that you may have had about, can I treat this person? Ultimately, if you're licensed in that state where they're physically located, yes. If you are not, it's very risky. I don't recommend it. If it's a emergency, then that may be a caveat, but you do so at your own risk. Again, thank you. I was very animated for this one. I feel very strongly about it. So I hope that this helped answer your questions. And if you have further questions, I hope you enroll in my CE course.